What's killing Texans? Our topic today is deep. Today's guest, Camerino Salazar, shares his thoughts about a situation that many of us are totally unaware. Dr. Salazar has spent decades in research, and as he explains these different themes you're about to hear, especially those around death by abandonment, they are heavy and layered. At its core, his message falls somewhere between a public warning and a prayer. He tells us, with facts to back up his observations, that when public systems like healthcare, mental health services, and schools are dismantled or defunded, people don't just lose access, they lose hope. And in too many cases, they lose their lives. You may strongly disagree with him, or some of what he says may make you feel uncomfortable. But my deepest wish is that our conversation helps spark reflection, dialogue, and that someday, maybe, we as human beings will find a common ground. When you subscribe to our show, you help us grow. Someone you know may need to hear this story, so please share with your family and friends and consider supporting our mission at therose.org. Let's talk about your breast. A different kind of podcast presented to you by The Rose, a breast center of excellence and a Texas treasure. You're going to hear frank discussions about tough topics, and you're going to learn why knowing about your breast could save your life. Nino, thank you so much for being with us today, and especially for coming in on your holiday. And you live in San Antonio, driving here, doing things with your daughter. So really, really appreciate you coming in.
No, I appreciate the time as well. So I'm glad it worked out.
So glad it did, yes. So now I want you to explain to us exactly where are you right now in your career?
Well, currently, I just recently completed my PhD out of the University of Texas at San Antonio. It was in demography, which is really the study of how populations grow, births, deaths. And then right now, I'm actually with another organization. They're called Health Resources in Action, based out of Boston. So it's a virtual position. And so I've been with them for a little bit over 3.5 years now.
So before that, you were in the public health sector for quite a while, right?
I grew up in the public health sector. I started at the medical school there in San Antonio as a research associate. And then transitioned over to University Hospital, which is the county hospital. Spent about 16 years there before moving over to Health Resources in Action.
So what attracted you to either of those areas?
I think it was just been always a passion for, looking to improve community health. My mom was a school teacher down in Brownsville, Texas. I know she always encouraged us to continue to school and the value of helping others, really through, our religious upbringing as well. And so I think tying all those two together, for me, I wanted to somehow find a way to help others. And I think through the public health arena that I hope through my work, through, the information that we do in terms of analysis, that we're helping others in terms of legislation, in terms of policy, to really make us a healthier state.
So you are a native Texan?
I am a native Texan, second generation now. But like every, the majority, right, of people that arrive here, my family came from Mexico from the Revolution of 1910. So I was telling my daughter now, I says, we've been here, about 110 years now. But like what we see now, there's upheaval in other areas, and then people come and they try to make a better life for themselves. And, again, that's what we tried to do.
And what is it that you do for the Rose?
Oh, for the Rose, the other hat that I wear, I'm actually the evaluator. I worked with Anna McAndrew at University Health when she was there in San Antonio, and then we stayed in connection. And I think the Rose at the time was looking for an evaluator for one of their cancer prevention research projects. And so I threw my hat in the ring, and, like the rest is history. But I thoroughly enjoyed being a part of the organization virtually as well. But it's been, you have a wonderful team here that you've assembled. So really enjoy that.
So, and Anna is our senior grant writer and certainly has brought so many opportunities to us and been very successful. explain to our listeners what an evaluator actually is. Are you an auditor? Are you a coach?
Interestingly enough, an evaluator can play many roles. I think you've hit the nail on the head. We are there to look at the program, and what we say is like to evaluate, to see, where are the opportunities, how well is the program working, is it being effective in terms of, your goals and objectives for the services that you're providing. And so for us, we try to take a very neutral approach to identify, where there's strengths of the program, where there's opportunities, and then we try to then, through information and data that we provide, in this case through the surveys we're collecting for the program, we try to tell the story of, again, how well are those services being delivered and received by the community.
And of course, we're talking about the underserved.
The underserved.
Medically
yes.
underserved.
Correct.
And most of these people are below the 200% of poverty level, which we all know is very, very little income. Right. And many are coming to us because they have a concern, or we've educated them about this is why it's important, and they're responding. But there's still so much work to do. I mean, this has been a long time trying to make all that happen, but there's still work.
Those opportunities still remain, yes.
Now, I'm going to go to your article about what's killing Texans. I've read it several times, and every time I see something different, and then I think, you're very factual in this article, and we're certainly going to put a link to it in our show notes. But there's also this passion that keeps coming up, just kind of bubbles up. So talk a little bit about that. Explain how it came about, but what was your goal in really digging that deep?
I think in writing the article, what's killing Texans, I think on the part of the work like you mentioned, I've been in the area of public health for many years, really on the applied side, and not necessarily on the policy side, but in the school, in the program I just graduated from, we were encouraged to use information to also advocate. Advocate for policies that we hope will elevate community health and well-being. And so when I was writing this, again, based primarily on my dissertation work, I think like you mentioned, the passion or the energy that kind of flowed through the article, or I think I attempted to do that, is to really tell a picture of what's been happening, for decades now in Texas, and what is a result of some of the legislation that's been put in place. And like you mentioned before we started to air, oftentimes policy is it can be very difficult for people to understand. But policies are, from the seatbelts we use to where we can smoke, when people, what areas they can smoke. So there's things that we sometimes see that are tangible, but other things, like the long-term effects of policies that we see when people begin to die in higher numbers as a result of certain causes, well, that's a little bit harder to nail down.
So give us some examples that you used in your article.
So in the examples I mentioned, first and foremost, what we've seen in Texas is about 150% increase in deaths from 3 causes: suicides, alcohol-related conditions such as cirrhosis of the liver, and I think drug overdoses, if those are the 3. Suicides, alcohol, and drug overdoses. And so when I started researching this, I first began with really drug overdoses, where in Texas, Texas has never been at the very top in terms of high drug overdose rates like other parts of the country, like on the East Coast or like even in West Virginia or these other areas. But I became so interested in this because I began to see these little blips and increases over the years. And so the first writing really entailed opioids, and that I found that the drug overdoses in Texas, about half were attributed to opioid overdose deaths. And so then that got me interested in looking at these other 2 causes, which is what 2 economists out of Princeton first researched and looked at, was these 3 causes of death. So my thoughts were, well, what's happening in other parts of the country? Is it happening here in Texas? And so, again, in my work, I find that in the last 20 years, in terms of data I've looked at, these three causes have elevated. But especially they've been elevated, or we've had higher number of deaths occur among those that are in the economically distressed areas of our state, non-Hispanic whites in particular, and middle-age non-Hispanic whites. But it's also now impacting Hispanics and blacks, which generally had lower rates of death from these causes, but we've begun to really see that. And so then I guess the other, I think, piece to that is, why has this been happening? Mm-hmm. And so that's where I tie in, or try to tie in, that some of the legislation that has been implemented over several years has really had a detrimental effect on our health, on Texas health. And the other pieces to that is, well, what examples would you say? Well, we have some of the highest uninsured rates in the nation. I think we're about 20% now, and continue. About 1 in 6 Texans is uninsured. Texas has refused to accept Medicaid or expand Medicaid, so we've left about 1 million people uninsured. And those, again, are estimates. We've had to close several rural hospitals. I think since 2005, we've had about 25 hospital closures in rural Texas. And so what that happens is, especially in the area, in those counties that are already underserved, those support systems are not there. And so if someone's looking for help, looking for preventive health, looking for certain types of services, they're very hard to come by. They have to travel miles, oftentimes, to another county to receive those services. So those are, I think, some of the drivers, that I was able to identify, through my research.
Okay, so let's go a little bit deeper. You referred several different times to this book, Dying of Whiteness. And we're having a hard time understanding how closing a rural hospital inadvertently or deliberately or whatever can actually hurt the white community.
So
now, you've got to use real little words for this.
First of all, yeah. So Jonathan Metzl, in his book, I first read it when I was taking my early courses in the PhD program that I was in, and our professor had encouraged us to, early on, begin to identify a subject that we might find interesting that we could then expand on. Well, I happened to come upon Jonathan Metzl's book, and so I started reading it and could not put it down. And really what Jonathan Metzl does is he does a case study, right? He does like a deep dive into 3 states, Missouri, Tennessee, and Kansas. And he looks at them in terms of, in a span of about 6 or 7 years. And for example, in Missouri, he looked at gun laws and how over time, over several years, they began to really remove a lot of the gun legislation that had been there in terms of gun safety, firearm safety, however you want to term it. But they really started to, the state legislator began to pull back a lot of those support systems in terms of gun legislation. And so they had like the permissive gun laws, such as carry and conceal, the castle doctrine, where you could, shoot someone, an intruder in your very home, and so it had all these mechanisms tied to, again, gun legislation. In Tennessee, it was really the Medicaid expansion, where the state legislature began to really find ways they needed to reduce or offset some budget deficits. So they began to really reduce the Medicaid rolls and really cut back on mental health services in that state. And then lastly, Kansas. What Kansas did was, Kansas at one point was one of the highest performing education systems in the nation. But again, the governor and the state legislature began to really look at education as an opportunity to cut back and roll back some of the services, because they again needed to cover some of their budget shortfall. So they began to really curtail the amount of money that was being allocated to these schools. And so in time, what they begin to see was the standardized scores, which, of course, we all like to, states like to really compare themselves against, or state legislatures like to compare themselves. The scores began to decline. Dropout rates began to increase in these schools. And where Kansas was one of the highest performing systems in the nation, it began to fall dramatically. But what Metzl also found was, across all these 3 states that he looked at, he also noticed that the health of these populations also began to elevate in risk. And what he noticed was that deaths from drug overdoses, suicides, firearm or homicides, and alcohol-related conditions as well, that in these 3 states, he also noticed that these began to increase. And so in Missouri, he noticed homicide rates started to increase, but in particular suicide rates, especially in non-Hispanic white males. But very similar in these other states that you also began to see these types of increases in the population in terms of these types of deaths. So the next question then was, he held conversations in these communities with individuals to ask them, well, it looks like the state legislature has voted against Medicaid expansion, has really encouraged or done away with a lot of the gun laws in your state. It looks like they've rolled back education funding to your schools. Do you support this? And so what he finds is, overall, the communities that he interviewed were very much in support of this. And so he asked them, well, why are you in support of this? Well, part of it is, he says, we want limited government. We feel that when government comes in, they have certain strings attached, and we want limited government. We want really our independence. We don't want to have anything to do with these types of federal resources. The other piece to that was, there was also this impression that in the example of Medicaid and education was that the funding that was being allocated to Medicaid and health insurance to the economically underserved was really going to other people that really, quote unquote, didn't deserve it. And I'm paraphrasing here. But the communities really felt that the newly arrived immigrants, those that they considered to be other populations that really shouldn't be receiving these services, that by them legislating against these types of, making these laws, enacting these laws, that by then they would curtail or limit those types of funding services or support for those types of populations. But in reality, what Metzl finds is that when those individuals voted against those very types of laws, that these individuals were the very individuals that tended to suffer from those cutbacks, from education, from health care, from these permissive gun laws, because they actually happen to be very economically underserved themselves. They just basically almost created this, it's them, but not us. But yet they were also part of that.
It's almost a boomerang type thing.
It's a boomerang,
yes.
Yes. And so there's always this, the whole thing of like you voting against your own health interests. Well, in this case, in all those 3 states, essentially that's what happened. They were really voting against their health interests. But really what they felt firmly was they were voting more as a framework of, again, less intrusive government. They felt this was their way of really advocating for themselves, for the communities, that they wanted to have as little intrusion from any type of quote-unquote government intervention, whatever that might be.
But that doesn't make a lot of sense, Nino.
Mm-hmm.
I mean, why would you do that to yourself? Or why, I know when we go to rural Texas, it is the white communities that are suffering.
Right.
I mean, it's, and they're the ones that have to travel. And if we didn't take our mammogram bus there, our coach there, they wouldn't get a mammogram. It's that simple. And we found a lot of cancers on first-time baseline mammograms. It doesn't make sense. And every one of these, 10 years ago, we could have partnered with a hospital. Not anymore.
Right.
So now we're having to find because those hospitals are gone.
Hospitals are gone. Right.
Why would we have voted that out? I mean, that doesn't make sense.
It's a very complex question that I think he, attempts to answer through his book in terms of like what's influencing these populations to really think or vote in a certain way that, again, at the end places them in harm and at risk. And I think very similar to Texas, through my own research, there is, especially in those counties where we have elevated deaths from, again, alcohol, suicides, and drug overdoses. Separately, closely after the election, I looked at the voting turnout for those counties. And, again, we had the recent election, Trump was elected, and actually his voting, the proportion of those that voted for him actually increased. And so when I was looking at those counties, it was really interesting to see that where you had those elevated rates of death, that those counties were extremely conservative. And I would say on average about 95% voted in favor of Trump, versus the Democratic candidate. And so I feel like, I have this idea, or similar to Metzl, is that in those counties, they were really voting not necessarily for the individual, but more for what he represented, which was limited government, limited. We're going to make sure that your money is spent efficiently. It is not going to go to these other individuals that are taking your funds and resources. The other piece to that is it also hits on what we term racial resentment. So in Jonathan Metzl's book, it really is. There's this argument that there's this racial resentment, and like he mentions, especially among the white electorate. Not everyone, but there are pockets where there is the general sense that he observed across these states that non-Hispanic whites or whites had a sense of also losing their place in society. That somehow communities were becoming more diverse. There was change underway. They felt they were not able to, have the same type of status that they once enjoyed. And so there was this risk that something was on the edges, something was coming on the horizon. And so then here comes the political ideology that's almost like, well, we'll place a hold on that. And this is how we're going to place a hold on that change. We're going to enact and we're going to do these things that are taking your resources away, basically removing your sense of power and perceived power from you. And so, again, very similar. What Metzl finds in those conversations with communities is a sense of loss. And so that's almost a reaction. So the question of like, why would they vote against their interests? Part of it too, he finds, is in this complex picture is there's a sense of lost entitlement. And as a result, there is, again, a sense that they're losing their place in this quote-unquote hierarchy in society. Mm-hmm. When in reality, that's not happening at all, but again, it's what they perceive. And so when they do that, and then enter the politicians or that argue and elevate this sense of loss. And so what do people do? Well, they go out and vote. And they vote for the things that they feel will hold things in place. And so Texas, I think, is, again, a really interesting case study, too. Like I mentioned in the article, Texas is not in Metzl's book, but it potentially should be, because it echoes a lot of the very similarities that you find in these three other states.
All right, go way deep with me, or maybe way shallow. I'm not sure which one it is. But why would what you're talking about cause more suicides in a white middle-aged man?
So part of the reason are, again, tying it to the article in terms of these policies of abandonment and neglect, is when these policies are in place and you begin to roll back these support systems, the mental health services disappear.
For everybody.
Social support for everyone, not only for these individuals, but for everyone. But again, in these deaths of despair, these deaths of three causes, very similar, we find in this population, middle-aged, non-Hispanic, white males, that there is a sense of loss, a sense of they've lost their place in society. Their work has moved overseas, which began decades ago. But the piece of you went to Flint, Michigan, and your father, your grandfather, your great-grandfather worked in the steel mills and in the factories, and then all of a sudden that disappears. Mm-hmm. New technologies come in, and so there's this loss again of opportunity, or perceived loss of opportunity, perceived loss of where do we see ourselves, finding ourselves, and also a rapidly changing society, not only racially and ethnically, but economically. Mm-hmm. Technologies have come in, and so this slowly begins to, and again, there's different theories. Some argue that it's been long term in the making in terms of this loss of opportunities. Others would argue that really it was the Great Recession that really elevated this risk among this population when you had, these job losses and insecurity. But at the end of the day, there is this loss of financial insecurity and instability mm-hmm. that people feel. And then here comes the opioid epidemic. Opioids get introduced. They find their paths into this constellation of causes. And now you begin to see this uptick in these types of deaths in these populations.
It's still very difficult to understand.
Mm-hmm. It is a complex, yes.
But it sounds like this is an attempt to get that control back, to get the power back, and not realizing how far-reaching some of these policies could be.
Correct.
All the way to really destroying communities.
Right.
I mean, that is sad. I think your use of the word abandonment, mm-hmm. That's a strong word. I don't think anybody can not have some reaction to that. No one wants to be abandoned. Yeah. But that's what you're saying has happened. Texas has abandoned Texans.
And I think it's it's a story of a loss of community, isolation. When this book was written, it was written right before COVID hit. Mm-hmm. So at the time, he observed already these risks that were kind of rising in the population. And now post-COVID, it's almost that it has really elevated this sense of risk and, again, rising death. We talk about life expectancy. Life expectancy is really the average number of years someone is expected to live from birth, to death. And the U.S. for a long time had high life expectancy, higher than other industrialized nations. But in the last few years, it has begun to really slow down, if not stutter. And Texas is an example, and these other states where, Texas has a life expectancy of about 78.5 years, which you would say it's a lot of years. It's a good period, but its life expectancy is lower than other states like Connecticut and Hawaii and Rhode Island and Minnesota, which often experience about 3.5 to almost 4 years of life expectancy greater. And in those states, what you find is you have greater support systems, more investment in healthcare, mental health resources, prevention services. While these other states that have experienced lower life expectancy, and I'll throw in Alabama, Mississippi, Louisiana are some of the lowest states in the nation with life expectancy, they also have really an erosion of social support for those populations, especially the most economically underserved that we provide or that we're trying to reach out to. So again, a very complex.
And you had one statistic in there. You're going to have to remember it for me. That had to do with women about this planing, that we weren't gaining any.
No, especially yes, among Texas females, what we've seen is actually decrease in their life expectancy. Part of it, again, what we see or what I see in my research in terms of those drivers like drug overdoses and But really, the mortality that Texas women are experiencing is really the maternal mortality, where we see some of the highest rates of mortality among Texas women, and especially in the last several years. And I know Texas has recently become a little bit much more restrictive in terms of the abortion bans and those other services, which actually are really a wrap-up of other preventive services for women. But really, in these types of legislative enactments, what you also do very similar is that you roll back prevention services, you roll back opportunities for access, you roll back, the confidence for women to go seek care in the first place. And so really, again, what this type of legislation tends to do is it's really intended to hamper, to limit, to deter. And so unfortunately, what then happens is there's these other repercussions where, women, which generally enjoy higher life expectancy than males on average, you begin to see some of their own health decline, especially in the maternal mortality side, which the state has issued several reports on.
Right. And everyone has a different reason for the cause, which is,
right.
I mean, it gets down to access. At the end of the day, it always gets down to that.
Right.
Is it your opinion that if you're poor, your health is going to be bad?
If you're poor, the circumstances are generally worse because this, number one, is you have the means are not there. And so there's a Matthew Desmond. He's written a book on poverty by America, and his argument is to be poor is to have no choice. And I think that's very telling, because in those that are in poverty, then they have to look for those resources or try to rely on resources that they can hopefully through public good can be made available. But when government begins to curtail those very services that the poor are in need of, the example like Medicaid, then people don't seek care. People delay care, the cost of care. And so those things, again, began to further undermine these communities, for sure.
So do you think the recent passage of the Big Beautiful Bill is going to make that even worse?
I haven't read any excerpts of the Big Beautiful Bill, but what I have read in terms of some of the legislators, especially from Texas, that actually have looked at it, that it does place into communities at risk again, because it does focus on cutting some programs to fund others. And whether it's SNAP, which looks at addressing food insecurity, to Medicaid, which looks at prevention and affording access, those communities that are the most vulnerable and the most fragile already will probably end up suffering the most, because it's these types of services that have been cut.
Well, and there's a bit of a myth going around. Well, Texas didn't expand Medicaid, so it's not going to get hurt as much. But that really doesn't make sense to me.
That doesn't make sense.
No.
That doesn't make sense. And like I mentioned too, you already have well over about 1 million Texans uninsured. And if you look at certain communities, the working communities especially, you have wages where people are not even able to afford daily living with the wages they're making. Right. And so again, it's this undercutting of social support systems that then at the end undercut health.
Right. I don't think we have such a small percentage of our uninsured who apply for help here at the Rose. They're all working. It's not like they're not working.
Right.
And I keep thinking, how do we have these myths going around? Well, that's just people not wanting to work. No, we see 8,000 of these, primarily women, some men,
yes,
that are asking for help. Simply, they can't afford insurance.
When I was at University Health, I had the opportunity to support a program called CareLink. CareLink is a financial assistance program for really the ones cannot affording type of insurance. And so they seek care at the hospital, and so then what CareLink does is it affords them some financial assistance. And when I was, asked to analyze some of their information, I always looked at, they have like occupation, vast majority working, and working multiple jobs, working, and to try to make a living. And so I think this idea or this concept that it's people that only want to, live off the system or take and drain the system, that's not the reality.
No, especially in Texas.
Especially in Texas.
The mothers recently, had children, are the very, very poor, something like less than $4,000 a year, are some disabled. That's the only ones that really get Medicaid. Mm-hmm. And it's such a misfortune that we have that concept, that these people just don't want to work. They're lazy. That's wrong.
Right. I totally agree. And I think part of it too is, I think in some of these states, their Medicaid eligibility is so restrictive too. And like you mentioned, the ones that are disabled and not able or impaired for other reasons. But again, the concepts exist that there's a population that's draining, taking, and so we need to do something about it.
Right.
And so again, I think it goes back to the whole, what we talked earlier about was this segment of the population that believes that, again, limited government, intrusion, those shouldn't be part of, where we live, but in the end, it's those types of services that enable help.
And everyone suffers.
Right. And like you mentioned, it's unless we try to confront it or we try to have more of a conversation, then these things are always kind of like, again, they're loose, they're
vague.
They're vague. And so then it never becomes really grounded. And so at the end, it is like we talk about. It's a very complex picture. It's history, it's ideology, it's economic.
It's tradition.
It's tradition.
If you came from a family that believes that, well, how else are you going to believe?
And their cultural norms, and I think that's very normal. We all come from communities where we have certain cultural norms that we support, and it's very natural to us. But when somebody from the outsider looking in, they may not see it as normal, but we see it as normal. And this goes back to, we talked about. There's some studies on vaccinations, where we notice that certain communities have lower vaccination than others. And part of it they find is that in those communities, well, that's kind of the cultural norms. And so when people move to those communities, they may not necessarily believe, well, I need to vaccinate or vaccinate my child. But what they find is over time, as those families live longer in those communities, they begin to take on those norms. And so then it becomes normal to say, well, I'm not going to vaccinate this year. No, I think they're good. They don't need, I've read more, I've heard more. So there's an influence, and now more than ever with social media,
right?
There's so many perspectives coming at you. And oftentimes we like to latch on to the perspective that we feel most comfortable with, that we feel ties into our value or cultural system. So again, I think it is very natural. I think like Metzl finds, it's very interesting, but at the same time, it's like these are communities that have normalized this type of thinking.
But it's deadly.
But at the end, it is very deadly. It is very deadly.
All right, one last question.
Yes.
What can average person, Joe Blow citizen do, if anything?
And that's a question that's been asked. And I think part of it too is, I always encourage people to think beyond what you feel comfortable with, right? To create an opportunity where like these forums or these types of opportunities where people can listen, can hear maybe a different perspective. They may not agree on it, but I think for that is that to further the conversation that hopefully begins to build some type of consensus. Yesterday my wife and I were, we were in Cyprus because, again, my daughter's water polo tournament was there, and we had dinner, and there's this little boardwalk, I guess they have by this little lake. And it was on a Sunday, of course, Sunday evening. And I see all these children from different race, just playing in this little green space. And I'm looking and I'm observing, thinking, about today's conversation. And I thought, this is like an open forum or space where everybody's just having a good time. Families from different economic backgrounds, different political ideologies, I'm sure, just having a good time, enjoying a common ground, a common area. And I just feel that in today, where we've kind of really taken sides and moved to one end of the post or the other, that I feel there's a need more than ever for some type of common ground that encourages compromise and that really encourages conversation, healthy conversation, really that thinks not that we want to change your mind, but that we want you to see our perspective or our side, from whatever, and to hopefully encourage that discussion that really begins to hopefully then rethink how we form policy and how we reshape it. Because in Texas, in the last census, Texas grew by almost 4 million people. 95% of that population growth was driven by racial and ethnic minorities. Almost half of that were by Hispanics. And in Texas, out of the 5 million students we have in public schools, 75% of the population in Texas are Hispanic. And so when you think of those numbers, you think of the diversity and how Texas is changing. And I think more than ever, there is need to really embrace that diversity, embrace those types of, whether it's in conversation or in other pockets, because again, I think it makes us a better state. It makes us a stronger state when we really not try to not confront change, but more encourage it in a healthy way.
Good advice. Good advice. Hard.
It's hard. Yeah.
Hard. Good advice. Well, thank you so much for being with us today. This was fascinating. And thank you for helping us to understand this very complex, very convoluted in some ways, systems that you're talking about and how we as just general public can help.
We appreciate it. Well, I want to say thank you so much for your time today and for inviting me to be a part of it. I really enjoyed it. Thank you.
Thank you for joining us today on Let's Talk About Your Breasts. This podcast is produced by Speak Podcasting and brought to you by The Rose. Visit therose.org to learn more about our organization. Subscribe to our podcast, share episodes with friends, and join the conversation on social media using hashtag Let's Talk About Your Breasts. We welcome your feedback and suggestions. Consider supporting The Rose. Your gift can make the difference to a person in need. And remember, self-care is not selfish. It's essential.